Over the past century, we have experienced horrific fires in hospitals, resulting in a grim number of fatalities. From those, we identified key conditions that needed to be resolved so that these tragedies would never happen again. For example, a common factor in multiple hospital fires was the use of extremely combustible materials and the absence of sprinklers and fire suppression systems. Other non construction based trends included things such as locked or latching doors and patient smoking within treatment rooms. To resolve these types of hazardous conditions, standards and regulations began to be put in place. These requirements became memorialized in various fire safety codes, eventually taking the name and current embodiment of the NFPA 101 Life Safety Code. As time progressed, new technological innovations provided earlier alarms, such as smoke detectors, to help diminish the number of deaths during hospital fires. We still had an unacceptable loss of life, which gave rise to the new idea of defend in place, which is the basis of our modern approach to fire and life safety within a hospital setting. These concepts of facility design were spread across a wide range of codes and standards. Recognizing the need for a reference targeted to both this unique facility and its fire and life safety approach, NFPA 99 was created in 1983. Without life safety codes in place, our hospitals would still be at a higher risk for fire and smoke emergencies. All these lessons learned have reduced the death toll through limiting fire size and reducing the numbers of fires in hospitals. We cannot allow ourselves to wait for the next tragedy to occur before we take action in protecting our patients. Given the nature and extent of the disease, of course the United States must find unconventional ways to treat its citizens affected by COVID-19. An increasing number of infected Americans has led to the accelerated approval and construction of temporary care facilities in an effort to treat more people than hospitals can safely hold. However, due to the need to rely on a contractor's ability to deliver a facility quickly, the focus on healthcare facility experience may be overlooked. This could result in the relevant hospital fire safety concepts and considerations being improperly applied or completely missed. Options being pursued include temporary tent healthcare facilities and use of existing large care facilities such as sports arenas. References to codes in a statement of work may not have the intended effect when interpreted by a contractor inexperienced in the unique protection requirements for healthcare fire safety. As an example, if a fire alarm system for a temporary facility relies on existing infrastructure, mass simultaneous evacuation would likely result. This directly contrasts with how healthcare professionals are trained to respond in a fire emergency. They are told to defend in place, relying on increased fire resistance of construction materials and the compartmentalization of smoke and fire spread in order to avoid a mass evacuation, which is not a realistic solution due to the inhibited mobility of many hospital-bound patients. Additionally, the relevant codes used in the construction of these existing facilities were never intended for the application to temporary hospital sites, especially not at this scale. As written, the national codes are meant to apply to specific scenarios or intended use of the facility, not to be generalized. If the temporary care facilities are deployed without properly applying the insights gained over the past century, we may see the death toll due to a fire emergency revert to numbers we haven't seen since 1929. This is where the Department of Fire Protection Engineering at the University of Maryland would like to help by offering their expertise. Our department is uniquely qualified, as described by our chair, Dr. James Milkey.
The Fire Protection Engineering program at the University of Maryland is the only ABET accredited fire protection engineering program in the country. This program was started in 1956 under the leadership of Dr. John Bryan. He wanted to make sure that all students were treated with respect and all students got individual attention as needed to pursue the kind of things that they want to pursue to make their educational experience here special. So that involves typically doing more than just classes. It involves research experiences, it involves internships, it could involve study abroad. There are an array of students who serve as our ambassadors that work with us in recruiting and outreach activities.
Maryland's Fire Protection Engineering Department faculty and alumni network is comprised of experts from all aspects of the field because as the leading ABET accredited program in the nation, they developed the field. They are dedicated to increasing awareness for fire safety and already have experience in long-distance learning. The equipment at our disposal allows professors to provide high-quality presentations to students across the nation. Lectures are both live streamed for real-time interaction with students, as well as recorded for those who require a more flexible schedule. Students may attend class from their homes, offices, or even out in the field. Additionally, the courses are linked to Canvas, a platform for online teaching that allows students to access course material, engage in class discussions, and interact with each other and their professor. With this in mind, the UMD Fire Protection Engineering Department wants to lend its expertise to the COVID-19 response teams. We can develop and host nationwide learning and collaboration across all U.S. Army Corps projects to teach about fire protection procedures, answer questions, and direct teams to resources. We can do this quickly, scaling the response to ongoing projects and archiving all sessions so that each project has access to all of the discussions and lessons learned. The University of Maryland Department of Fire Protection Engineering stands ready to assist the U.S. Army Corps of Engineers to rapidly and effectively meet their mission to deploy safe alternative care facilities across the U.S. in response to the COVID-19 pandemic. Please feel free to contact us with any questions or concerns.